Drug fever. Drug fever is defined as a fever, usually above 38 degrees Celsius, that appears after a drug is administered and resolves within 2 to 3 days of stopping the drug, assuming no other cause for the fever is found. So, drug fever is a diagnosis of exclusion. Let us see class of common drugs and their examples that causes drug fever. The first is antibiotics. From antibiotics, penicillins, cephalosporins, sulfa drugs, vancomycin, and rifampin is known to be an etiology for drug fever. From anticonvulsants, carbamazepine, phenytoin, and lamotrigine. From cardiovascular drugs, quinidine, procainamide, and methyl-dopa. From antipains, some non-steroidal anti-inflammatory drugs and salicylates. Certain chemotherapy agents and some antidepressants and stimulants can cause drug fever. Drug fever typically appears 2 to 8 days after the initiation of the causative drug, but this can vary significantly depending on the drug and the individual factors. For some drugs, like antibiotics, the life frame might be 1 to 5 weeks, most commonly within 1 to 2 weeks. In contrast, antineoplastic agents might cause fever within 3 to 4 days of administration. Drugs cause fever by different mechanisms. From this, the most common mechanism is by hypersensitivity reaction. This is similar to an allergic reaction, where the body's immune system reacts to the drug. The other mechanism is pharmacologic effect. The drug itself may alter body temperature regulation, and also fever can occur at the injection site after parenteral administration as a local complication. The fourth mechanism is idiosyncratic reactions, which is unpredictable reactions that are not dose dependent. Besides the fever, other symptoms might include chills, fatigue, and the lack of increase in heart rate or relative bradycardia. Some individuals may also experience a rash or other risky manifestation, which might be a component of Rett syndrome. Drug fever is a diagnosis of exclusion, meaning other potential cause of fever need to be ruled out first, such as infections, inflammatory conditions, malignancies. If drug fever is suspected, the patient should also be observed for fever pattern, time of onset relative to drug administration, and other clinical signs. Other factors to consider include time of onset. Fever may appear within 7 to 10 days of starting the medication and disappear shortly or within 72 hours after discontinuation. The other is severity. Drug fever can range from mild to severe, and in rare cases can lead to conditions like neuroleptic malignant syndrome and individual susceptibility. Not everyone will develop a fever from specific medications, and the risk can vary based on factors like genetics and pre-existing conditions. Let's see certain clues to consider drug fever. Drug fever is a fever that develops after drug administration and typically within 72 hours of stopping the drug, and is not due to another cause. Clues that suggest drug fever include the timing of the fever relative to the drug administration, the absence of other cause for fever, and few other clinical and laboratory findings. From this, the first is timing. Drug fever typically appears after 7 to 10 days of drug administration, but the onset can vary and dependent on the drug. The other is resolution. The fever usually resolves within 42 hours of discontinuing the drug. And rechallenge. If the drug is restarted, the fever will likely reoccur within a few hours. The other is clinical clues. Absence of other causes. A thorough investigation is needed to rule out other potential causes of fever, such as infection, malignancy, or autoimmune disease. And drug fever is well known to cause relative bradycardia, a lack of increase in heart rate despite fever. And drug fever might be a component or one part of Rett syndrome or drug-induced rash and systemic symptoms. Rash such as maculopapular or urticarial eruptions can present. The other clinical clue is inappropriate sense of well-being. Some clinicians note that patients with drug fever may appear relatively well despite the fever. And general symptoms such as headache, myalgia, arthralgia may also be present. The third one is laboratory clue. From laboratory, eosinophilia or increased eosinophil count in the blood is a common finding. And also decrease in white blood cell count may also be observed. The other is elevated liver enzymes. Increased aminotransferase or alkaline phosphatase may indicate drug-induced liver injury. And the other is increased ESR or CRP levels might be present. And on CBC, thrombocytopenia or a decrease in platelet count might be another clue. Overall, clues to consider drug fever include typical early onset, 7 to 10 days, unremitting pyrexia, multiple negative blood cultures, patient appear inappropriately well, relative bradycardia, 4 degree of pyrexia, CRP level disproportionately low, remits on drug withdrawal. So those are clues to drug fever. The primary treatment for drug fever is to discontinue the suspected drug. Re-challenge with the drug can be done to confirm the diagnosis if the fever returns, but it is usually only done in suspected cases and with careful consideration. Symptomatic treatment with antipyretics like acetaminophen or ibuprofen may also be used to manage the fever. If the diagnosis is correct, the fever will usually alleviate within 24 to 48 hours, and the diagnosis will be confirmed. If a patient is having fever, which is persistent for more than 72 hours after discontinuing the presumed drug, there are other possibilities that should be considered, including dehydration or uncontrolled sepsis and the like.